Hey everyone, it's Nurse Dani, and I am joined by two of my friends. This is so fun for me. It's like a reunion. I have my friend Cindy, who works on the mother-baby unit at Utah Valley Hospital, and Mandy, who works on labor and delivery. We used to spend a lot of time together at work before I quit and moved on to other things. But I'll give them a chance to introduce themselves in a moment, but I also wanted to let you guys know what we're going to talk about today. We are here to share with you what nurses feel like you need to know before you come to the hospital to have a baby. So feel free to ask questions during the live stream, and we'll get to a few of those at the end. All those burning questions you've been having. So ladies, first of all, introduce yourself. Cindy.
My name's Cindy Mason. I've been a nurse in the mother-baby department for 22 years.
That's a long time. She's got a lot of experience.
I just love it. I love all about maternity and dealing with the moms and babies. So, yeah.
And you have kids of your own?
I do. I have 3 boys. So, yeah. It's been a great experience. I worked there before I had the babies, and then it was definitely different, once you actually had them. What I kind of thought would happen kind of didn't. But yeah, it was a good experience.
And we're going to get to that a little bit later. How about you, Mandy?
Okay, I'm Mandy Childs. I work on labor and delivery at Utah Valley with Cindy, and I've worked as a nurse for 13 years. Same job, labor and delivery. That's why I became a nurse, was to work here. And I have 5 kids, and I had some kids before, and then I have 1 kid after I was a nurse.
That's an interesting perspective.
So
How was it different?
I got to see all the things that I didn't realize what they were doing or why. And then when I went through it, I was like, oh, this is a whole different experience. So,
did it make a difference to know more?
It did, yeah. It made a huge difference. I feel like I just looked at things differently. I knew why they were doing things, so it made me a little more comfortable with a lot of it. So,
yeah, definitely. It's so important to understand the why behind it. So to get us started, let's talk about things a woman should think about before going to the hospital, like who's going to be there at delivery.
That's huge.
So what tips and suggestions do you have for women and couples as they talk about who's going to be there? Because this is a discussion that should happen long before the day the baby's coming.
Right.
Yes.
Yeah, so explain how you might approach that.
So I think a lot of people come to the hospital and they haven't told their family yet that they'd like to have that moment alone, or some people want the whole family. So it's different. Everyone has their different idea of what they want. So it just, like you said, talk to them beforehand, make sure that you and your partner are on the same page. Because you can get there and then the partner wants someone else to be there that you weren't comfortable with, and they just get invited in at the last minute, and that maybe is not what you were hoping for. So
that could be super awkward.
Yeah. And it's happened
supposed to be such a happy day.
So many times that I never see people until they're in the hospital in labor. So this is great that we can tell people, talk to your partner, let them know who you want at the hospital, make sure you're on the same page, and then just nicely tell people, hey, this is what we're planning, this is what we want. We'll let you know when to be there, or try to and be a little bit bold.
Yeah, so, I like that. Be bold. I mean, and really, along with that, dads, you shouldn't have a say in who's there because you're not the one in stirrups.
In the end, if it comes down to it, where the patient wants someone and the dad wants someone else, it will be, or the partner, whoever it is, the patient will get the choice. Because that is our patient. That's who we're required to go by. So, not that I want to be choosy, but if you got to be on the same page.
We're her advocate.
And if not, she's my patient. So, yeah, I think that's
We've had a lot of, I personally saw a lot of arguments between mother-in-laws.
Yeah,
I was going to say,
moms and mother-in-laws.
I have an experience with that because on mine, I'm the only girl. So my mom really wanted to come, and I was like, okay, yeah, And then my husband was like, well, if your mom's there, then my mom should be there. And I was, and it just was because I didn't want, and I didn't want to make either of them feel bad.
Did that happen before the day of?
No, it was the day like my mom was there, and it was just kind of all of a sudden, they were both there, and then just kind of when it was go time, they both just were there, and I was like, okay, so I guess they're both
happening.
And I didn't, it would have been good to have the conversation before because I don't think you think about that. Yeah. And I mean, it was fine. But
you want to set the expectation for everyone.
Right.
Yeah.
And you need to also be aware that whoever you invite into the room is going to see everything. So as your nurse is trying to protect your privacy a little, there are moments when you can't. So you just have to know that they are going to see a lot of things. And if you're okay with that, great. But if that's something that you're very uncomfortable with, then make sure you choose people that you don't want to, it's just, there is no way that we can completely cover you up.
Great tip. So. Well, and when it comes to family and visitors, are there restrictions?
No, not really. I would say some people during the delivery, some doctors, no one really limits the amount of people, but they may say, we want you all on this side of the room. And so there's only limited standing room. So for some people that may limit it, but otherwise, no, I don't think so.
No.
Yeah, so just basically give it some thought.
Standing room only, some deliveries sometimes.
Yeah, it has. People love to have a big party, and they have people come in from all over, and they have grandpas and everyone, but other people just want the two of them. So
yeah, it just comes down to the woman's preference and letting everyone know what it is, it sounds like.
Absolutely.
Okay. So what about naturally inducing labor? That's a question that I get a lot on Intermountain Moms. People are like, I am full term now. I want this baby out. What can I do to get the baby out? Is it even possible to naturally induce labor?
It is really hard to do that. There are a few things you can do, things that don't work. The things that do work, I would say sometimes in the office, a doctor can strip your membranes. That does work occasionally, but if your body's not ready, it won't.
This is like stirring the pot. The name sounds really scary, right? Yes. But this is basically just like simmering the pot and getting things to think about.
I like that analogy.
It causes that. I've never heard that. Do a check. They do a couple things that make it so that the membranes separate from themselves and it releases prostaglandins. So naturally releasing prostaglandins would be the way to do it. That would be that, and having sexual intercourse with
the same thing that got you there in the first place may get you out.
Those are the two things I can think of that actually possibly work, and they might not work every time, but they would be your best chance.
I remember there was a patient that I was sending home for the 3rd time in my 12-hour shift. I felt so bad for her. And, every time we're talking about when to come back, and she kept coming back because she was still contracting, but her cervix wasn't changing. And again, we'll talk a little more about this later, but I was like, this may be the last thing on your mind, but go home and have the most passionate sex of your life. And maybe we'll keep you next time.
Oh, I hope she came back.
Yeah, I know. I never heard the end of that story. So
I bet she delivered.
I hope for her sake she did.
That is, we don't want to send anyone home, but if you're not in active labor, you don't want to stay in the hospital and be stuck in one room for 8 hours and then go home.
Yeah.
We want you to go home and come back when you're at the prime time where an active labor is considered when you're changing your cervix 1 centimeter per hour. So since you don't know what your cervix is, it's hard to tell.
There's no way to tell.
How do I know when my cervix is changing?
Yeah.
You don't. So
no amount of pain is an indication about how you're changing.
Pain is pretty big. Usually, if you're feeling contractions and they're starting and stopping, they're uncomfortable, but they're, you're kind of thinking, is this a contraction? Is this not a contraction? It feels kind of like menstrual cramps. That's probably not it yet. That might be early labor, which means you could be going into labor, but the contractions that change your cervix are usually so painful, you would have to stop complete talking, sit down, or
hold on to
grab onto something. Yeah, you are, it's a lot of pain. And so once you get to that point, if you are getting to that point, we can only tell you by checking your cervix. So that's when you come in. If you get sent home, and that's not quite the right time, don't be frustrated. It happens all the time.
I've heard a ton of patients say, I don't want to make that walk of shame. Please tell me I'm staying. And I'm like, it's not something to be ashamed of.
Well, everyone's pain is so different, too. You'll have some people that are about ready to deliver, and they're like, I'm just kind of, feels irritable.
Exactly.
And then you'll have
a few people.
You'll have others
who
that
are not super.
For sure, it's go time for the epidural, and they're like, a half a centimeter,
It's more rare
dilated.
to not have the pain with it, but it happens. Some people are like, I never got to that pain till right before I delivered. That's more rare.
Yeah.
But I've seen that.
And so people shouldn't be surprised if they come to the hospital and we just kind of like sit on them for a little while, because we have to see if you're going to change or not. I kind of think that sometimes women feel abandoned unless we explain to them what's going on, because we need that hour to see if the cervix is changing. And so we want to monitor the baby's heart rate and monitor mom to make sure she's stable. And
we want to give you the hour to change. We want to give you the whole hour to make sure that you have time to change that centimeter. And unless you come in and you are, advanced dilation, 7 centimeters, 8 centimeters, and agonizing pain, of course, we're going to just keep you and admit you. But those earlier numbers, even 1 through 5, you could sit at a 3 or a 4.
Even a 5.
Even a 5. You could sit there for weeks. It doesn't tell a lot, and it's super frustrating, but the numbers
so it's not a number that determines if you're in labor. It's the change.
It's the change. And if you were 2 days ago and now you're a 3, that's still not a centimeter per hour. So that's progress. Great. And maybe you'll stay today, but it could just be that you slowly changed over those 2 days.
Yeah.
So, that's a one we get a lot.
Definitely.
Just don't feel bad if you get sent home.
It's okay.
It's okay.
So what about castor oil? Under no other circumstances would someone look at this bottle and think, I should drink that.
No.
But when you're desperate and willing to do whatever it takes to get a baby to come out, some people have heard from moms, sisters, family, friends.
There's a lot of things you hear from moms, sisters, family, friends that just know.
And maybe
That's
they
so true.
did do that back then. Maybe they did. But there are reasons why we don't do that now.
So why shouldn't you drink castor oil?
First, I just want to explain that I had a bottle of castor oil in my cabinet with my first baby, waiting for me to drink it. And every time I went to drink it, I got really nauseated. I couldn't do it. And I never took it. But I would have.
It's kind of like a good aversion. You should have an aversion to that so that you won't drink it. Yeah.
Luckily I did. But lots of people swear by it. So I got one. I never took it. But the people we do see that come in, it causes you to contract. Not in a good labor pattern where you're every 2 to 3 minutes. It's almost constant. It doesn't change your cervix any faster, but it's constant. It can cause uterine rupture because of that constant contraction. It doesn't give the baby or you a break. So a lot of times we'll see bleeding with it. Yes, the uterus is not ready for that to happen.
And then if you actually see someone that took castor oil and the things that come out of
there's also other side effects associated with it, because it's actually used for constipation in other arenas.
And some people would say, I took it, diarrhea like crazy, cleaned me out, I went in and had my babies. So yes, it cleaned me out and did both. It doesn't usually happen that way. It usually happens
simultaneously.
So if you don't want that.
Those precious moments of trying to capture when there's stuff all over the baby and everywhere.
That's what happens.
Yeah.
So, and I won't say this is a fact, but I do see on the tracings, usually if someone's taking castor oil and there's this weird contraction pattern, the babies are usually struggling with it.
Yeah.
I see that more.
Well, it's kind of because essentially when you're contracting, it's like the baby is essentially holding their breath.
They need a break.
They're not getting any blood flow. And so if the uterus is never like relaxing, then it's really taxing for the baby.
Yep. So even if you get an epidural and you're great, your baby is still getting, a uterus is still contracting like crazy and in a weird pattern. So yes, no castor oil. Not
Just
even a tiny bit.
So walking, moving around, if you're contracting a little bit, then you could start moving around to kind of encourage those, but it won't necessarily make you go into labor. It sounds like there's really nothing you can do to induce labor. It'll just happen when it's going to happen.
Right. And when it gets ready, I guess if you are starting to, if you go walking, you'll notice they happen more often. Mm-hmm. But if you sit down, they might go away. That's not quite true labor yet. Mm-hmm. True labor, if you sit down but they continue to pick up, that's a good sign of true labor. So.
I want to share my story with my second when we're talking about this, because I was contracting a ton the night before I was supposed to work a day shift. Mm-hmm. And, you go in at 6:00. And so I was like, well, what better place for me to be than at work?
Yeah.
And so I was like, I'm going to work and hopefully have a baby today too.
Yeah.
And when I got there, my friends checked me and I was 4 centimeters and 90% of your face. And the doctor that was on was like, well, when you're 5, we'll break your water and you'll have a baby. And so I was like, oh, good. Hopefully I'll be on my feet all day and this will just help.
Yeah.
And it did. I would contract a ton while I was on my feet, but then when I sat down for a little while, they'd go away. And that's how I knew it wasn't time yet. So that's kind of like a good way to gauge, should I go to the hospital yet or should I not? Because if you're up and moving and they're continuing, great, but then rest for a little while and see if they continue.
Yeah.
Yeah.
That's a perfect way. If you rest, and you don't need to go out and do the walking to put yourself into labor. It's honestly, sometimes it's more painful, and you will contract, but then you'll just be in pain.
Yeah, and it didn't do anything
rest,
for you.
Yeah, take a bath, rest, unless your water's broken.
Yes.
If your water's broken, come straight in, no matter what. But if not, take a bath, relax. If they continue to pick up, and not just the amount, but how strong they are, you might be getting there. So
those are all great tips and suggestions. So I'm hearing like, okay, when you go, you should go to the hospital if you're contracting. How often?
3 minutes maybe, but some people come in at 5 minutes, and I've seen them labor and change their cervix, but I would say 3 to 5 minutes.
And this is when you're full term, not preterm.
Yes.
So what's the definition of full term?
Full term is above, 37 and above.
Okay.
Don't go try to induce labor or walk or do anything before that.
Yeah.
If it happens, it happens.
Well, babies actually do best at 39 weeks, and so you shouldn't even encourage it before then.
No, 30, exactly.
Yeah.
37 is when we classify it as full term, but they even sometimes struggle with breathing.
Yeah.
Or even eating.
Yeah, definitely. It's good to keep them in a little bit longer if they'll stay there. So contracting every 3 to 5 minutes. If your water is broken, you mentioned that. What other reasons would you want to come to the hospital?
If you have bright red bleeding, let's see, if you're, I guess,
Fetal movement?
trying to think, decreased fetal movement. Yes. If you're feeling like your baby moves all the time, and today it's just been really quiet, not a lot of movement, and you're worried about it, call your doctor's office, ask them what they want you to do. They may want you to come into the office. They might have an ultrasound there. Who knows? If you're worried and you can't get a hold of your doctor, just come right in. And we check that all the time.
Trip. Because I always would tell my patients, like, they're like, oh, it's so stupid, I shouldn't have come in. And I'm like, no, because now you can go home and sleep.
Yes.
And peace of mind is priceless.
Yes, that's true.
Yeah.
And you know that everything's okay. And so it's never a wasted trip. We're always happy to see you.
Yeah.
So now I'm in labor. We kind of talked about like who's there, when to come in, some other things to think about. How long does labor usually take?
Oh my goodness. It can take an hour, and it can take 30 hours. So there is not a time frame. But the standard is once you get into active labor, that centimeter per hour, it usually is about 1 centimeter every hour from there. So if you come in and you're a 4, plan on about 6 more hours at minimum. And then at least an hour on your first baby, sometimes up to 3 of pushing.
Now, wait, I just need to pause for a second, because if you didn't know that, that's huge news. Like, what? I'm going to push for 1 to 3 hours?
Yep.
Yes.
That is huge. And it happens. It happens. And sometimes the baby's in the right position. Everything looks good. And it's still, for some reason, 3 hours. It's just maybe the baby's head is turned just a tiny bit and is not fitting quite right. So, I've seen people push 3. I've even seen 4 before. And then I've seen someone on their first baby go to push, and we had to stop her so that the doctor could get there. So it's more rare that you push. I would say 30 to 1 hour is pretty standard.
For a first time?
First time. Plan on an hour. Just plan on it.
And then if you've had a baby before, how does your first labor differ from your second and third, fourth?
Faster. Usually your labor is quicker. It's usually about half the time. But I've seen people go longer on their second because maybe their baby's posterior the second time around. And then pushing is usually, we don't even push with you before we have the doctor come to the room first.
Just in case they do slip down a little bit faster than we were expecting.
So the second, so just now you're going to do this probably hardcore 1 to 3 hours one time. And then after that, you will have between 5 and 30 minutes.
You're paving the way for any and all other babies you'll have in the future.
Yep.
Next siblings to come.
Yeah. So how about birth plans? And birth plans can include information about labor and delivery as well as the recovery period. Should women come with a birth plan in hand?
They don't need to at all. In fact, it's fine if you do. If you feel like you need to have things written out and make sure that you address things and you'll forget about it, great. Do that. Get a birth plan. Just know that your birth plan will probably change at least one aspect of it.
It needs to be fluid.
It needs to be fluid. You need to be able to change everything about it if necessary for the baby's safety and your safety. Sometimes the baby's doing great, but we have to change something for your safety. So
I think that's really hard because people do these birth plans and they are like, okay, this needs to happen, this and this and this, and
especially
they've
if
talked
you're a planner.
about it.
Like if I
I
have the
planner,
personality where I get this because I have lists and I plan my life, and any uncertainty to me is just not acceptable.
Yeah.
right.
But this is one
exactly
time in
how it
life when you need to keep an open mind.
Yeah.
Right.
And, as nurses, we do all we can to support the birth plan. My patients will often show me it, and I'm like, that is great. I want to do every single thing on there. But there's times because of the mom's safety or the baby's safety that we can't. And, sometimes we'll have people to be a little bit offended. They're like, this was the plan. And so I try to explain, well, so this is the reason why I'm telling you that it would be. Yeah. And, some are great and they understand, and others it's like, no, like, this is how it's supposed to go. I'm not breaking through this. I'm not, this is, I have to do it this way. Yeah. And I think that really sets them up for feeling disappointed and
I think
like that we're not
traumatized.
Well, and I think too that they get frustrated with the medical staff, that we're not able to do exactly everything on it. And we do the best we can with it, but we obviously are not going to.
And I do. I sit down with the birth plan or with the patient and the birth plan, and I just look right over and say, so far we can do this, this, this. This one we can't do because maybe your water's broken and your doctor doesn't allow you to get into the bathtub at this point. Those are things that are between your doctor, and I'm carrying that out. So I will let them know. And so there's things that we can't do. The goal is we're trying to be safe and get you the experience you want. And sometimes those two things don't go hand in hand.
Yeah, there's plan A, and then sometimes there's plan B,
and
C, D, E.
All the way to Z.
Yeah, all the way. Yeah. So just know that, and you don't have to come in with a birth plan. You can come in and say, I've heard about skin to skin. I really want to do that.
And the nurses ask about it.
We ask this
even
anyway.
if people don't bring it up, we usually prompt certain discussions about like breastfeeding.
Most things that are on the birth plan, we already do standardly now.
Yeah.
There's things that you may want that are unique or different, and just make sure you talk to your doctor first. That's huge. If there's something you want that's specific, talk to your doctor. Make sure they're okay with that. Because things with the delivery, they may not allow that. Most doctors allow the dad to cut the cord or the partner to cut the cord. I can't even think of one that doesn't. But if your doctor didn't, that wouldn't be anything to do with me or the hospital. That would be between you and the doctor. So if there's something you want, talk to them.
Share your birth plan with them at your prenatal appointment.
Yes. Make sure they can accommodate
not just at the hospital. But then we want to know as nurses too, so that we can do what we can to support you.
Yes, exactly.
Yeah. Okay, great tips there. You were telling us, we had an interesting discussion before actually going live about expectations and about what other influences in our lives may do to portray ideal birth and how that affects how a woman feels about her experience. Kind of expound on that.
That is probably the biggest thing when you said come and talk about these things. What would you want to tell your patients? That would be the biggest thing that I would tell any patients. What you're seeing on the internet, on people's birth plans, on their Instagrams, it's amazing. It's beautiful. Those are edited clips. They are filtered. Things are put perfectly to music, and they're amazing. When you come into labor, it doesn't happen just like that. And so I think that people expect or want that. Of course, we all want that. But if it doesn't go that way, or if something shifts and they end up pushing for 4 hours when they didn't expect to, and they're exhausted and they're throwing up, and maybe they pooped in front of their husband the first time.
They're just mortified.
Yeah. Or they're standing crowd.
Or they're standing crowd.
There's just so many things that can happen that can alter that experience and make the person having the baby feel like it was their fault, or they did something wrong. They couldn't achieve that perfect scenario, which I get that all the time. Almost a PTSD of,
Yeah.
I ended up in a C-section. It was traumatic. I did, this happened. The baby was on CPAP. I didn't see the baby for 2 hours. They go through these things and they come out on the other side. They can't even look at their birth experience and have a happy feeling. They are just
looking at all the things that weren't met instead of the things that went right.
And so I think if you just know, I'm trying to get a safe delivery, and hopefully all these things happen.
And I'm going to have an exciting story to share when this is done.
Right. No
I'm just excited to see how it's written, kind of thing. Yeah. I felt so sad. This really pricked my heart. We've been doing Intermountain Moms for 8 years now, and this is one of the first women I ever interacted with. And she asked a question. She asked for clarification about her experience because she'd just been rolling it over in her mind. And she, I think her baby was like 5 or 6 months old, and she said that she was struggling with depression and PTSD because of it. So I asked her if she would be willing to share a few specifics about what happened, so I could maybe try to walk her through it. And she described a perfectly normal first-time mom experience. And that's what touched my heart and made me sad, because I'm no one explained to her what she needed to expect. She said she was in labor for 20 hours and pushed for 2 hours, and they had to use forceps to pull the baby out. And how often do we see that?
Yeah.
Especially first babies. Forceps.
Yeah, but no one explained that to her. She had a much different idea in her head of how it was going to go, and because it didn't match up with that, she struggled.
That is exactly what I see. It's not matching up with what you expect, and you're not to blame, and that's actually very normal. People will always come in with their birth stories, or someone will say, and then this happened, and then they ended up doing this, and I'm like, pretty typical. I don't want to be rude and say, no, that's normal, but I want everyone to expect that that happens quite a bit.
We're not insensitive to that fact. We just want people to understand so that they for themselves can have some peace about it.
Yes. Yep.
Yeah. So hopefully, that alone, if there's nothing else people walk away with today, hopefully they walk away with that. So Cindy, there's a lot of different things about recovery that, holy cow. And even though I taught prenatal classes for a few years before I had my own, like you're saying, there's a different perspective you have when it's you afterwards.
Oh, yeah.
I thought I knew what to expect, and I still was blindsided by some things, because it's way harder than I thought it was going to be.
Definitely. Definitely.
So what are some things that women should know about recovery? In the immediate recovery period, what's normal to expect?
Well, so after you have the baby, you're going to start bleeding a lot. It's funny. I've had people be like, "Oh, I didn't think I was going to bleed."
Right. That always.
Yep. There's a lot of bleeding.
It seems like a lot compared to what you're.
Yeah, and they haven't bled for 9 months, right? They've had the period hiatus, so you're so pumped that you're hoping that continues. But so there's bleeding, and what I often find too is that the patients get so bugged because we'll come and we crede rub, the uterus because we want that uterus to be really tight.
Say that word again, crede.
Crede. So that other people might say beating. Yeah. This is what I've had patients grab my hand and be like, "What are you doing?"
That's the only time I've ever been hit.
That's the only time I've been hit too. Yeah. And she didn't try to, and she felt so awful afterwards.
It's just reflexive.
The clause too, where there are some really choice words that have come to me, but it's okay. But I always explain to the patients, I'm like, "Hey, so listen, what happened is inside of uterus, that placenta ripped off. So we have an open wound inside there. So just like you put pressure on your arm, if you cut your arm, I want that uterus really tight. And so when I rub it, it's going to help get that tight. And so then I feel like they understand. There's still claws and there's still some things that happen, but and then I try to explain that to them. And then also we're wanting them to get up and urinate too, because if that bladder gets too full, again, we'll run the risk of having hemorrhaging. And so if the uterus isn't able to be tight, or the bladder gets too full, or, sometimes women will have the clots, and I explain that too, where the placenta ripped off, the kind of clots start kind of to form. And sometimes they're not able, and we just have them dropping through. And so we watch that really carefully. We try to help with breastfeeding. That's a really big, we try to do the skin to skin as soon as possible after delivering, and then work on the breastfeeding. And the first couple hours, we want the babies and moms to be together as much as possible.
A lot of people think that we just love to separate moms and babies.
That is a huge shift change.
Yeah, it is.
When we first started,
it
was you had your baby, and on your first check, we did a few things to check, and by your second check, we were whisking baby out of the room and down to nursery to get assessed, and then mom was meeting up. That's how we did it. And then you get the feedback that to the
wanna
bond
be
with the
with them,
baby,
yeah.
the skin to skin, how important that is. So as we get that feedback, we change things. We switched our whole process, and we try to keep baby and mom together for the first couple hours if we can.
Even then, even if there's an issue, that we'll bring the baby down, or with moms with C-sections, we'll sometimes bring the baby down with that as well. But we actually will go, we used to bring the babies to the nursery, but now we actually take the isolette and take out into the room and actually do, which is so fun, because then everybody can see the whole admit. It's cute. I had a dad be like, I love this so much. This is so awesome. But I'm just going to say this. I kind of wish I had the other, because it was so fun just being me and my baby.
That was their part of the experience.
All the people.
They felt robbed.
I have heard that too.
Yeah,
But
it was
then
really cute.
Moms, it's the first time they've ever watched their baby get a bath. That's
And a
I
lot of
never saw
times
that.
they miss it. Yeah.
And
they see everything too, and then because a lot of times right after delivery, right, we're just wrapping them all up, and so seeing all the toes and hands and everything, and we always kind of talk through what we're doing with our admit too, with the baby, so the moms love that as well, that they can kind of see what we're seeing and make sure everything's going well. So that's really definitely been something I've appreciated over the last few years, that we've really wanting to keep those moms and babies together, which is so important.
Yeah,
but if your baby does get taken away to the NICU for, there's a little a space in the NICU that's just for that transition phase, where if a baby's struggling to breathe, they're breathing okay, but they're not breathing optimally, then they, rather than leave them with mom and then risk that they're back in the NICU in 2 hours that can't breathe at all.
With more problems,
we do a little CPAP mask and put that on, help the baby for that first hour or two sometimes. That's okay too. That's not maybe what you planned.
If you don't get the chance to do skin to skin right after, it doesn't mean that you have missed that opportunity forever.
Correct.
Well, the whole CPAP's been amazing too, because we used to bring the babies down and we'd try to work with them, because a lot of times they'll have some oxygen issues where they're having a hard time, and we used to just mess with that in the nursery, try to give some blow by, try to do stimulation and all these things, and the babies continually were having some grunting and things. And so the hospital is amazing that they developed this program, that if we are noticing some retracting or grunting or some issues with the baby, that if we take them to the NICU right away and do that CPAP, they do awesome. Typically they do.
And then they stay with you the rest of the time instead of coming back 6 hours later and they're depleted, and then they're there in the NICU for the whole time.
Yeah.
So that's been huge.
It's been a big decrease in our NICU ones that would have been
Short-term
there for a long time.
separation for a long-term benefit, basically. Yeah.
So that's not ideal. You want your baby right there, skin to skin. But if that happens, it's okay. Your baby is actually, this is a benefit for your baby.
Yeah.
So.
And again, this is an example like on a birth plan where if a mom said, I want to have my baby with me and do skin to skin after, then we're like, awesome, we do too.
Yes.
And then
but we
the
also
only
want
reason
them to breathe. And if they're not breathing well, we have to weigh the two, and that's ends up.
Plan B would be giving them the assistance they need and then getting you back together.
The partner can always follow, so you can have someone go with the baby, but that's not, people aren't really prepared for that, because that's newer in the last few years we've been doing that. But we see so many babies that don't go to the NICU anymore. They just end up transitioning downstairs, so that's huge.
Yeah. So safe to say we want to keep moms and babies together. We do everything
That's
we can.
always our
talk about rooming in too.
Yeah, so that is, we've always offered that, whatever the patients are wanting. Some were, wanting only to have the baby around, some we're like, let's just have the baby in the nursery the whole time. I just want some.
What are like your options, and what do we mean when we say room in?
So currently, Intermountain, we're working on, doing that, rooming in the babies with the mom, and they stay with the mom the whole time. What we've learned is that the babies do better, being right next to the mom's learning the feeding cues.
She gets confident.
She gets confident. And having, we go in and help support them with that. And so they're really pushing a lot of this baby friendly, which is amazing, and that's what we want, to help mom learn how to, when she goes home, to take care of this baby. And then there's the time, right, where it's so fun. I go talk to these cute moms, and they just are so tapped out, and they just say, I'm sure I'm the only one that has ever done this. And I'm like, honey, every shift, at least 3 or 4 people I go and talk to that they are just tapped.
Well, I have a live-in nursery. I'm going to take advantage of it before I go home.
If that's what you need, that's okay too.
Yeah.
You know, so ultimately our goal is to have the babies rooming in, that they're with the moms and they're in the rooms and with that. But, you know, it's okay. If they need a break, great. That's what we would be more than happy to do, whatever we can to help facilitate that. And sometimes, you know, that baby needs this break because the mom really just...
Yeah, moms need to be
they need to heal.
emotionally and physically stable. So if they just did 30 hours of labor and pushed for 4 and ended up in a C-section, they may not do room in.
Yeah.
And that's okay. And that doesn't happen very often, by the way. Sorry.
Yeah.
Well, the mom guilt too, so much too.
But that does happen.
Well, the mom guilt too. So they're just like, I know right now I'm supposed to be feeding. I know I'm supposed to be, I should be pumping, but they can't even hold their head up. And it's like, you know, we're going to do that. And we'll take care of all of that. But right now we're going to take a nap because it's not going to do you any good nor your baby if you're beyond exhaustion.
Yeah.
And so let's just make sure that we're taking care of you too.
A lot of times moms feel like it's selfish for them to take care of themselves. But if you don't take care of yourself, you're not worth anything to your family.
No.
Right, exactly.
Yeah, we need to make sure that you're doing that. And, you know, another big thing that we really, Intermountain have worked on is the postpartum depression. And so we actually piloted a postpartum depression screening. And I can't tell you how many people have come to us and talked about how that literally saved them or helped them feel validated because they felt like they were the only ones that were feeling that way. Because it's really common, the hormone shifts and everything. Like I talked about, so many moms, you know, will go in after that and they're just tapped and they're crying and really upset, and then the kind of the baby blues, you know, which was quite common too with all those hormone shifts.
So what's the difference? What's normal to expect, and then when do we need to call in the reinforcements and?
So, you know, having those hormone shifts, totally normal. You're exhausted. You just went through a ton of stuff. You know, have a lot going on with that. And so a lot of women will get very weepy. Going home, you know, again, having some more of the lack of sleep, feeling like the expectations that I need to have
like 4 solid hours of sleep, you're a new person.
Right.
Well, it's fun. I've had patients be like, well, I read that book, that baby wise, and the baby's supposed to be sleeping this many hours. And I'm like, okay, here's the thing. That's awesome. You do all that, you read all the things you want to, but it just realize, expect the unexpected. Every day is going to be different. And if you think every single day is going to be the same, you're going to be disappointed.
Yeah.
So, you know, treasure those things that you feel like went right. If there wasn't, then it's okay. That's fine. No worries. You know, if the baby's doing great, you're doing great. That's all that matters. But where we worry is that, you know, after they've kind of had the baby blues and it's gone on a while and they start getting where they're struggling so much. They're not wanting to get out of bed, that they're feeling, you know, that they aren't capable of taking care of the baby, that they even have thoughts of harming themselves or the baby. You know, I had a mom talk to me and she just said, I just remember thinking, this baby deserves better. I don't care. I don't want to have this baby to have me as a mom. I'm a horrible mom. But then they don't want to tell their partner, right? Because they're like, oh, I'm looking, especially like the Instagram, you know, which is, again, that everything's beautiful and they're slipping on their size 2 jeans, which...
Right. No.
Ladies, you will not go into your jeans right after. Let me just tell you that. That's
don't even bring them out for a lot. Certainly not to the hospital. And just leave them in that box.
You bring those maternity pants and then just enjoy, or your stretchies, whatever. Just go with that and then be happy. But so I really feel like that we've really opened the door to talk to the patients about it. And when I'm doing teaching, I actually talk to the dad and mom in there and just say, let's just have a deal that you guys have this open communication.
I love that.
That because I know, like, if my husband was like, you're acting weird, I'm like, you're acting weird. Don't tell me, you know, because you don't want that, you know? You know, and so, but if it's ahead of time, say, right now, we love each other. Our goal is that we're going to be great parents and we're going to take care of our baby. So if you feel like you're concerned about me right now, I'm going to take that, and there's no shame, blame, guilt, any of that. The whole concern is I love you and we're going to work through this together.
Times you don't notice it about yourself.
No.
And the partner or your family notices things and say this is not their norm, or they might be acting completely normal. But inside their head, they've got a lot going on that they're not sharing. So you could see either. Someone could be completely different, or someone could be acting just like themselves and their head is just... Usually the guilt, that whole guilt of this baby deserves better. I hear that so often, and it's not real. Those are not the right those are the thoughts that.
That's with the depression.
Yeah.
So with the screening, it's awesome because we do one in the hospital. And so if it gets to an area where it triggers, then we actually have social work kind of come in and talk about the different resources and kind of help get you set up ahead of time. Some women, it's, if they're kind of in that zone that they maybe have worried about it before, that they've had it, they've got great information they can just have there, because sometimes that's the whole battle, right? You're like, I am so tapped out, but I don't have the energy in trying to find who I need to call.
Yeah.
Like I'm just done. I don't want to deal with this. And so having all those resources, I think, has been really amazing. And then after they go to the pediatricians are actually screening as well. So it's been great. And then also the OBs on their postpartum have also. So there's been so many that have been caught, and therapies or medications, and that's okay if medications are needed too. That's a big thing too, that people are like, I don't care. Whatever it is, I won't take anything. I'm not crazy. I won't take anything.
And that kind of goes back to breastfeeding. And we need to talk about that too, because some people are like, I have to breastfeed. And then they feel guilty if they're on an antidepressant or something that makes it so that they can't breastfeed.
Yep.
And that adds to feelings of guilt and shame. And it's this vicious cycle.
Cycle.
Formula-fed kids go to kindergarten too.
Yes.
It's true.
Whatever happens, it's okay. That is what I tell my patients all the time. You can't expect that everything's going to go right. And breastfeeding, that's a whole other thing we could talk a long time about, is that a lot of moms think the baby comes out and just and on.
And sometimes they do.
Well, sometimes they do. And it's like,
and it's miraculous. Like, I was telling every patient, I'm like, I need tissue because I'm going to cry for you.
But usually it doesn't go that way. And sometimes, it's just a matter of time and things work. And sometimes it doesn't. And it doesn't work.
Sometimes in spite of all the work in the world, it still doesn't work.
Yeah. And that's okay. It's okay, and your baby's going to be amazing. You're an amazing mom. This has nothing to do with your capacity to be an outstanding mother. And I'll have ones that be like, well, I didn't nurse my last one, so go ahead, shame me. I'm like, I don't care. That's great. Okay, so what do you want to do this time?
Or I didn't nurse my first one, and so I'm not going to with the others. But try each time. Every baby's different. Every pregnancy, every labor, everything's different. If you want to do that, try it again. If it doesn't work,
might go totally different. Yeah. I've shared this a lot of times on Intermountain Moms, how the first time was terrible. I got about just every complication you could have under the sun. Mastitis twice, bleeding nipples when I was pumping, low supply, tears every day over this, and it was awful.
Yeah.
And then the second one, I was like, okay, I really want to try, but if it doesn't go well the first day or two, I'm moving on because I'm not going to put myself through that again. And he came out and he ate like a piranha. And it was fantastic. And I
think sometimes too won't, because they had a bad experience, so they don't want to set up with that. So I always ask the patient too, now are you doing this because you absolutely don't want to, or is it because you had a bad experience? Whatever it is, it's great. I just want to have the communication.
How do I support you? And that's why we want to know. We don't want to know because we have an opinion about what you're doing.
I think naturally the moms, right? If we ask that, then it all of a sudden goes to the naturally it's the shame blame. So I was like, no, honey, I don't care what you do. I whatever's fantastic. I just want to make sure if that's something you really wanted to do, but for one reason or another it didn't work. Let's do it. Let's do whatever you want to do, and we'll give it our all. But
and nurses and lactation specialists, and there's lots of resources in the hospital to help you. And when you leave,
and when you go home, there's a lot now. There's a lot of different opportunities to get the help if that's what you're wanting to do.
Do you guys have any like last gems or words of wisdom that you want to leave everyone with about the experience?
I just think the most important thing is, two things. Comparison is the thief of joy.
I love
Do not compare yourself to anyone, any situation. And then also there's no wrong way to have a baby. If you end up in a way you weren't planning, it doesn't mean it's wrong. It just is a different path. So those, and the Emily effect for postpartum depression. Go to that site. It's amazing. So.
It really is. I like to talk to my patients too, and the mom and dad, and just say to them, you guys figure out what works for you guys. You guys talk and figure out, if you're like, we love binkies, we're doing binkies, and someone comes and's like, kid's gonna have messed up whatever, all the things. Like, if you're wanting to do half formula, half breastfeeding, whatever it is you guys decide, and then everybody else, you're just like, okay, that's nice. Thank you for that advice, because everyone has so much to say. They have so much to say. And even since I had kids, you're bombarded with the internet and like I said, all the social media stuff where people are like, this is the right way to do, this is, and
Or
as long as you and your
should
partner
breastfeed in public, or
Yeah.
you shouldn't breastfeed in public. If you're not comfortable, don't do it. If you are,
what works for
do
you
it.
guys, yeah.
Right.
It may not work for everyone.
Yeah, whatever you guys feel comfortable, you two are ultimately the parents. Everyone has great advice. So, if somebody is like, you guys, okay, that's great, but everything that people say is not truth. And that has to be what the answer is. Because that's where you these sweet moms, they just want to do the best they can. And they're great, wonderful moms, and they're capable and smart and everything. But if you constantly are thinking you have to fit in a certain mold, there's so much gray with being a mom
It's true.
and dad, and
Yeah.
just realize that. So that's what I would say.
I love that. I appreciate you guys coming today. I mean, really, these are the faces of the nurses at the hospital when you come to have your baby. And we really just want what's best for you. We want people to have an amazing experience. And I love what you said about it's not a wrong path. It's not a wrong path for labor and delivery. It's not a wrong path for parenting. It just may be different than someone else's. And that's okay. It's yours. And you can own it and appreciate it because it's yours. So hopefully that was helpful for those of you who are looking forward to having a baby or who have already had one before, because every single experience is different. Maybe we've learned a few things for those of us who are done having kids about how we can support women who are having babies and those that we know in our lives. And of course, if you guys have questions in the future, if this has prompted a few, then you know where to find me on Intermountain Moms, Facebook, Instagram, and YouTube. Have a great day.